Welcome to this special celebration of International Women's Day. My name is Jeremy Fernandez and I'm a journalist and presenter at the ABC. In line with the global focus from UN Women, the theme Women in Leadership Achieving an Equal Future in a COVID-19 World celebrates the tremendous efforts by women and girls around the world in shaping a more equal future and recovery from the COVID-19 pandemic. All over the world, women have been entrusted with holding the front line in managing this disease and in service delivery, but remain underrepresented in leadership. And that's not to mention the upheaval of institutions and responsibilities at work and at home, which have disproportionately affected women. So the challenge is not just to bounce back from this pandemic, but to come back better than before, for everyone. Inclusion and understanding is a shared responsibility for all of us. Together and individually, women and men need to be conscious of our roles as leaders and allies, modelling inclusive behaviours, exercising empathy, and keeping each other accountable to champion the unique qualities of our peers. This event is supported by the New South Wales Public Service Commission and the Age of Inclusion, a movement dedicated to supporting and advocating for people living with disability and all areas of diversity and inclusion in the workplace to build a culture of respect and equality. We have an exciting agenda today. The New South Wales Public Service Commissioner, Kathrina Lo, will provide an opening address followed by 3 interviews. Our first is with Dr. Kerry Chant. I'll be discussing with Dr. Chant the invaluable work of our frontline doctors and nurses and the work they've done through this pandemic, plus her leadership role as the Chief Health Officer for New South Wales Health. Next, I'll be talking to Lil Gordon. Lil is the Head of Aboriginal Affairs, and we'll be discussing the New South Wales Government's COVID-19 strategy to protect Aboriginal communities. And our last interview is with Nas Campanella. Nas is the ABC News Disability Affairs reporter, and we'll discuss the impacts of COVID-19 on people with disability and her reporting on the Royal Commission into violence, abuse, neglect and exploitation of people with disability. But now, before all that, it's my pleasure to introduce Auntie Anne Weldon from the Metropolitan Local Aboriginal Land Council to deliver a welcome to country.
I stand before you on the land of the Eora Nation. I am a Wiradjuri Koori Balang. My name is Anne Weldon and I come from Irambi Aboriginal Reserve in Kerry, New South Wales. My ancestral bloodline connects all along the lands and the waters of the Clare and the Murrumbidgee rivers. I am a board member of Metropolitan Local Aboriginal Land Council, and we are the cultural authority under the New South Wales Aboriginal Land Rights Act that we are meeting on today. This morning I certainly bring you a message of respect and caring. And it is important to acknowledge this country's rich and first and original history. I would like to pay my respects to elders, past, present, from all of our Aboriginal and non-Aboriginal communities and nations here today, and express my gratitude for the sacrifices made by our elders to create a better quality of life for all peoples in our country. And it is indeed a humble privilege to provide a welcome to country. For me, it is a profound honour and a luxury of time. Time that has been given by you and time given by many warriors that created the traditions for everyone in our country. And a welcome isn't just words, it's a reflection of where we are, not this modern day structure, but the continuous link of life, lesson, purpose and nurturing supplies. And the boundaries of traditional owners are not defined by the hand and a pen, but through the natural landscapes of our incredible country. The Eora Nation's country spans from the Hawkesbury River to the north, the Nepean to the west, and the Georges River to the south. And on behalf, but more importantly with the permission of Metropolitan Local Aboriginal Land Council and our members, I welcome everybody to the land of the Gadigal people and the Eora Nation. And I acknowledge the Gadigal people's spirits for they shall always, and ancestors, for they shall always remain within their land, our Mother Earth. And whenever you travel across this beautiful continent of ours, you are entering the lands of a nation, a tribe and a clan which have existed and belong to these lands for more than 60,000 years. First Nations, my people of these lands, we are the most diverse, unique and sustainable people on the planet. And we are the oldest living culture of the world. And it is important to acknowledge this country's rich, first and original history. So let me pay homage to the many warriors that have created the pathways for all of us, the ones recognised and the ones that we have never heard of. And our journey and milestones will only be realised if we can see, if we can feel, and if we can be a positive difference put into real action. We must commit to making our world, our society, inclusive, breaking through barriers, not creating them. All of us together can bring about positive changes to multiple generations, starting with the healing of past generations, by declaring what should not have taken place to our present-day generations, giving them hope. For our creators have shown a way to creating a better future for all and our next generations, for everyone in our country. But sadly, the lessons have been learnt at our expense, and at our devastation should and must be acknowledged. But to listen, learn and come together to heal and prevent heartaches from ever happening again. As you connect, learn and share today, tomorrow and beyond, please don't live regretting what should have been done, but create the legacy of what must be done. For our future is only as good as our history, and we need to reflect upon the footsteps that we are all leaving and to know where we are heading, shaping a world that we can be proud of. And the truth needs to be told, but it must be heard if we are to walk together. For I was taught to further my vision through the realisation of endeavours to protect our diverse culture, to protect and respect our land, our language, our emotional and our spiritual well-being, our ceremonial ways of prayer, and through my journey, educate and nurture our children, grandchildren and my great-grandson, and for all of our children. So join me by learning from the ancient and living teachings of these land's first people. We can all draw upon my people's spirit as we continue on our journey together. We believe our ancestor spirits walk beside us, guiding us and lighting our way. And we ask that you walk beside us. Please do not walk ahead of us and allow my people to create our own pathways to reach our own destinies. I want to take this opportunity to thank the New South Wales Government for allowing me to conduct the Welcome to Country at your International Women's Day event. And the theme is Women in Leadership, Achieving an Equal Future in a COVID World. So I ask you all to draw upon my people's spirit and allow them to guide us. Once again, I thank you, and on behalf of Metropolitan Local Aboriginal Land Council, I want to welcome you to the land of the mighty Eora Nation. Always was, always will be Aboriginal land. And I also wanted to share with you, here's to strong women. May we know them, may we be them, may we raise them. Thank you very much.
Good morning, everyone. As New South Wales Public Service Commissioner, I'd like to welcome you to our 2021 International Women's Day event. Thank you to Auntie Anne Weldon for welcoming us to country. I want to acknowledge that I'm joining today's event from Gadigal land and pay my respects to elders past, present and emerging. I also acknowledge the traditional custodians of the various lands from which you're joining today's event and extend my respect to all Aboriginal people present today. In the context of International Women's Day, I'd like to further acknowledge the important role Aboriginal and Torres Strait Islander women play in our community as elders, mothers, grandmothers, sisters, daughters, aunties, artists, storytellers, curators and custodians. They've carried and preserved the oldest continuing culture on the planet for at least 65,000 years. Throughout history, they've been leaders, activists and social change advocates, and their passion, strength and resilience has paved the way for past and future generations. Their voices have and continue to influence positive change across our state and nation. I'm honoured to open today's event on achieving an equal future in a COVID world. Over the past 12 months, we've seen women across New South Wales and the world at the forefront of the response to the pandemic. Today, I'm excited to hear from three highly respected guests, Dr. Kerry Chant, Lil Gordon and Nas Campanella, and gain their insights on the year that was and the work still to come. I'd also like to thank Jeremy Fernandez for being our MC today. International Women's Day is a great opportunity for us to celebrate the achievements of women. It's also a reminder that achieving equality requires all of us to get involved. Gender equality is not just a women's issue, it also requires allies to step up in the workplace and create a culture that builds a greater sense of belonging. 2020 was a huge challenge for most of us. I'm glad we can come together today to continue important conversations around gender equality, inclusion and the work still to be done in this space across the sector and in our work with the wider New South Wales community in a post-COVID environment. When we think about what a post-COVID environment looks like for women in the workforce and in our communities, we need to be clear on where women were in the pre-COVID world. We know women were still taking on the lion's share of domestic labour responsibilities, that the gender pay gap is 14%, that women retire with 47% less superannuation than men, and that women over 65 are one of the rising groups experiencing homelessness. We know COVID has disproportionately affected certain groups in our communities, and we've seen the effect COVID has on women. We've heard countless anecdotal stories of women continuing to take on the bulk of domestic labour throughout the pandemic, while caring for children who are unable to go to school or elderly parents who were unable to venture out into the community. Globally, women still spend around 3 times as many hours on unpaid domestic and care work as men. While we can laugh and sympathise with the funny anecdotal stories, we need to remember that this approach to sharing domestic labour is an entrenched form of gender inequality that can prohibit women from engaging in the workforce and from having a healthy work-life balance. Recent studies have indicated that COVID has pulled Australian women 4 years further from economic gender equality, with economic impacts leaving more women without full-time jobs. The average gender super gap rose to 26% last June, and there is a continued risk of this gap widening. Economic inequality also disproportionately affects women and children suffering from family and domestic violence, and it's important that we as leaders, colleagues and allies continue to have conversations to make it a priority to progress work on these issues. The challenges of the past 12 months have brought more sharply into focus the need for our workplaces to be inclusive. There was a need to ensure our people are and continue to be supported and remain connected, and to care for the well-being of others as well as ourselves. I'm passionate about diversity and inclusion, and it's a particular focus for me as Public Service Commissioner. During my career, I've experienced firsthand how being different from the status quo means you work harder to get a seat at the table and to get your voice heard. One legacy I would like to leave when I finish my term as Public Service Commissioner is a more diverse public sector workforce, including at the senior leadership levels, that better reflects the diversity of the community we serve. Gender equality and inclusion are key areas of work for the Public Service Commission. For the past few years, we've been working with the sector to embed flexible working practices on an if not, why not basis. Flexible work has many benefits, including enhancing the ability of our people to manage various aspects of their lives and contributing to higher staff engagement. COVID has seen an acceleration in the take-up of flexible work, largely due to necessity, but we'll need to ensure we don't slide backwards as we emerge from COVID. The 2020 People Matter Employee Survey saw an increase in the percentage of people who are satisfied with their flexible work arrangements, 65.5%, up from 59% in 2019. There was also an increase in the percentage of people using flexible work, 78%. As many of us shift to a new hybrid way of working, we need to consider what we mean by inclusion beyond the physical office or frontline delivery environments. How might people best feel included when working from home as well as in the office? How might we be unknowingly excluding people when our teams are dispersed? As our ways of working change, we need to stay accountable to how we evolve our approaches to inclusive workplace culture. I'm pleased to see that the 2020 PMES results indicated an increase in favourable responses for inclusion and diversity questions, including 80% of respondents saying their workgroups treat each other with respect. This survey is an important way for us to seek the views of our people and ensure we're focusing our efforts in areas that will help us affect real change in our workplaces. I was also encouraged to see that PMES respondents indicated that witnessing instances of bullying had decreased from 33% to 22%. While this is positive, no level of bullying is acceptable, and we need to continue our work and conversations about how to further decrease this number. In our 2020 PMS survey, we introduced new questions which specifically asked staff if they'd experienced sexual harassment at work. 4% of our respondents answered yes. This number is not okay. While there are systemic changes that must be made to see this number decrease, we all have a role to play in calling out inappropriate behaviour as it happens, checking in with our colleagues who need support, and making ourselves available to give extra support when it's needed. In our new hybrid working environment, we need to ensure staff continue to feel safe when working, but also have the ability to safely speak out should they ever need to. The Premier has set clear expectations around our world-class public service targets. This includes increasing the number of women and Aboriginal people in senior leadership roles and the number of people with disability employed in the public sector by 2025. We're on track to reach the target of 114 Aboriginal senior leaders. To reach the target of 50% women in senior leadership roles, 6 out of 10 appointments to these roles will need to be women. Reaching the target of 5.6% of our workforce comprising people with disability will take focused and concerted effort across the sector. Last year, the Public Service Commission launched the Age of Inclusion campaign to build a movement of dedicated supporters to champion workplace disability inclusion. We also released a range of guidance and tools and implemented a number of initiatives to support the sector to increase disability employment. This included the Tailored Talent Program to recruit neurodiverse people into STEM roles, setting up the Disability Employment Network, hosting employee and manager forums, and developing inclusive leadership skills in our senior executives. This year, the Commission will continue working on an inclusion strategy to broaden the conversation on what inclusion and belonging means to public sector staff and how it impacts them in the workplace. Good inclusion practice must recognise that our staff come from all walks of life and are not defined by a ticker box approach to identity. There is no one-size-fits-all approach to inclusion. What works for you will be different to what works for me, and we need to consider how the multiple characteristics that an individual has may impact on their experiences in the workplace or as a customer of the New South Wales Government. While there are important changes that need to be made to ensure these targets are achieved, it will also take action from all of us to ensure we create an inclusive workplace culture that welcomes and supports these important changes. Progress on this work is happening, and we will continue to be innovative, unafraid of failure, and work with these communities to ensure that different voices are part of the conversation, the solution, and our success. International Women's Day is a great opportunity for us to reflect on the work we have been doing and evaluate how we shape the work we do going forward. I thank all of you for taking time today to engage in these important discussions and encourage you to keep the conversations going with your team and more broadly in your workplace. Enjoy the rest of this special event.
Dr. Kerry Chant has become well known to the New South Wales public during the COVID-19 pandemic. As the virus bore down, she activated the state's test and trace system and ensured New South Wales was well placed to respond. Dr. Chant was named Public Servant of the Year in the 2020 New South Wales Premier's Awards for her pivotal part in the state's COVID-19 response. Dr. Chant is also the longest serving CHO in the state, having been appointed to the role in 2009. Kerry Chant, good to have you with us.
It's a pleasure to be here.
Did you ever imagine that you would be in such a critical job at a critical time when you first set out in medicine? What's it been like for you?
It's been a bit of a roller coaster. It's been an incredibly busy time. And whilst it's been really tough, it's also been incredibly inspiring just to have the opportunity to work with so many amazing people. And it's also been a period where we've just had to accumulate knowledge, respond and change direction, incorporating those learnings. So it's been a continuous process for now 13 months, and now we've got the vaccine to roll out, so that will be another chapter in our response to COVID.
What drew you to medicine in the beginning?
I've always liked, when I was at school, science, I was drawn to that. I did a year of pharmacy and then transferred to medicine. So I think whilst many children know exactly what they want to do, I think others, it's hard to imagine what jobs are like. So I worked in a pharmacy for a period and I really enjoyed that, but it did inspire me to transfer to medicine for a different experience.
Australia has had some tremendous success in dealing with COVID-19 right across the country, notably here in New South Wales without the need for mass lockdowns repeatedly. What do you put the state's success down to?
Look, I think overall the Australian response has been amazing. And I think partly that's through the way in which states and territories and governments have worked together. So some of the border measures and the implementation of those border measures were critical to our success today, our quarantine program. In New South Wales, I think the success has been because we've worked effectively as a team, and I mean outside health. We've acknowledged the important role of other government agencies, the leadership of across government, in order to achieve the outcome, because we can't do it individually. It is really about a team. It's also been about leveraging off the assets that we have. We've always had a strong health system in New South Wales, and that's a geographically based health system. We've got what's called local health districts. And I think the connectiveness of those local health districts to their local communities has been one of the key strengths of our response.
I think for a lot of people it felt like a big leap of faith to put so much faith in that front line at such a critical time. Would you see it that way?
Yes, it's been an emphasis on those frontline capabilities we've had, but I would also put into that mix the community. And for me, learning about COVID and our response, it has been about how we can work together and a real sort of sense of partnership. I think the principle is we've tried not to impose things on the community unless it's been absolutely necessary to do so, but in return we've asked the community to go about their way in a COVID-safe way. We've asked community to present for testing, and I'd also like to say thank you to the business community who have similarly implemented those measures. So it truly has been a partnership between the community, business and a whole of government.
We've seen the value of public health being elevated like never before, and a lot of those frontline workers, service deliverers, have been women. Do you think that can be preserved once the pandemic is over, that public health remains front and centre of the way we manage public health?
I think there certainly has been, in health there is quite a good representation of women and also diversity across the board. I think health does well in that regard. I think that public health I think the community's understanding of public health has grown as we've had that ongoing dialogue with the community. I think that what that's taught us about it is about the importance of those systems. It's about the importance of having the capacity to reach communities and engage with communities. And I think the leadership and the engagement we've had across government that has been necessary and essential part of our COVID response will also allow us to work in partnership with government on some of those other thorny problems that we need to tackle in that whole of government way.
We know women have disproportionately borne the brunt of the economic and social impacts of this pandemic. What can employers, workplaces do to accommodate that better?
I think we need to acknowledge that COVID has put stresses on all segments of the community, but that has fallen disproportionately on those in more vulnerable employments. And as you rightly say, in many of those settings such as hospitality, women are well represented, and so therefore the burden potentially is greater for women. I think what we need to do is not separate about women or men. I think it is around recognising COVID's economic impacts and doing all we can to ensure that we minimise the sort of need for restrictions, minimise the impost, whilst achieving control of COVID. But I think we all need to understand it's been a very hard year. We've got vaccines to look forward to, but navigating 2021 will also be challenging as we learn the effectiveness of the vaccines and how we can even further calibrate our public health measures once we progressively roll out the vaccine.
We've heard many reports during the course of the past year of an increase in domestic violence, particularly during lockdowns. UN Women has called this the shadow pandemic of violence. How much has women's safety, particularly during lockdowns, been a consideration for you when you've been managing public health during this pandemic?
I think that we try to measure and understand what we're doing to control COVID and the unintended consequences. So clearly we've been concerned about people not engaging in healthcare because they're fearful and delaying those critical preventative health appointments or even seeking care. We've been worried about domestic violence. We've been worried about a range of social and impacts on people's health and well-being more broadly. We do factor them into our considerations and we try and learn as we, because there is no roadmap through a pandemic, and some of those things will be things that we have to understand the magnitude of scale and then adjust that into our thinking next time round.
Looking at COVID data from around the world, there's some strong sense there that women leaders have done better during COVID. Do you think that's down to a different style of leadership? Is it gender-based? Why is there that success in countries particularly and bodies and agencies that are led by women?
Look, I think I'm not going to attribute success in a gender way. I'd just like to reiterate that sort of success comes when you have good systems, when you have good foundational health systems, when you have equitable access for the population to health systems, when you work effectively across government and you have good government and decision-making processes. And it's a cohesive response and a respectful response. And you are respectful of the community and you engage them.
What's your best advice to pass on to other women, particularly those who aspire to senior levels of leadership where they're broadly underrepresented?
My first advice would be do what makes you're passionate about and makes you happy. And I think, you know, not all women have to aspire to senior leadership roles to contribute productively, be happy. And so I think, again, we shouldn't put pressure on women to do other than what they want or what's good for their family. So I think sometimes that's a key thing. And we should respect everyone's contribution. It doesn't matter if you're a leader, it doesn't matter if you're a cleaner at the front line. You're still contributing very important things to society. My advice to women would be, have a go. Don't underestimate your ability to contribute. I think sometimes women may be more hesitant about taking the next step. They may not see themselves as ready. And I think it's important that other women and leaders, men and women, perhaps reach out to women to encourage them to take that next step, to apply for that next senior position.
When we think about diversity in the workplace, that covers a whole range of things. What are the priorities for you there in terms of making sure that a workplace is diverse, equal, and that people are treated respectfully?
Look, I had the privilege outside the COVID response to lead the Population Health Division, and for me, it's a privilege to lead such a diverse team. Some of the issues we tackle, such as very sensitive issues like drug and alcohol, sexually transmitted diseases, bloodborne viruses, are often sensitive, and we need a very diverse team that brings different perspectives to really enrich and enhance our response. So if we take that to COVID response, we need diversity. We need people that are of diverse backgrounds, that are of diverse skills. All of those aspects enrich our teams. And throughout the COVID response, we've drawn on those different perspectives within health. We've often reached out to people to get sort of grassroots feedback on what it means for their community, what might be moving on social media or what might be the concerns. We get advice about how to reach communities, what are the barriers to accessing care. So that diversity in a team adds and enriches the team's capacity for decision making and the quality advice we're provided. So I would commend everyone to embrace diversity.
Kerry, Chant, it's good to talk to you. Thank you.
Take care.
Lil Gordon is a proud Aboriginal woman from Brewarrina Nyampa country in northern New South Wales with more than 30 years experience working in and alongside Aboriginal communities. At Aboriginal Affairs New South Wales, she leads and influences change in government to support the social, cultural and economic aspirations of Aboriginal people in New South Wales, making sure their voices are heard and interests represented. Before becoming the head of Aboriginal Affairs, she held senior executive roles at TAFE New South Wales and Barang Regional Alliance. And she also taught in high schools and juvenile justice and correctional centres. Lil Gordon, it's good to have you with us.
Thank you, it's great to be here. I would like to start by acknowledging country and acknowledging that I'm meeting you on the lands of the Gadigal people of the Eora Nation and pay my absolute heartfelt respect to our elders past and present and heartfelt respect to all countries and acknowledge all elders across New South Wales. Thank you.
Thank you, Lil. Now, you've had an extensive career working alongside and in Aboriginal communities and education and training, particularly with young people. Take me back. What drew you to that?
Look, I don't know that I was drawn to it initially, so as you go through school you don't necessarily know sometimes the direction that you want to go in. Coming from a little small town out west, Brewarrina, we moved from there to Maitland when I was about 14, so I went from being in a small public school to Maitland Girls High School, and from there going through to year 11-12 in Rutherford High School, which was a newly formed school. I was particularly good at sport. I didn't feel necessarily that I was a leader in those roles, but on most occasions I was the captain of various sporting groups. So my teachers at the time said, why don't you consider this as a career? So I went down that approach and ended up going through Newcastle University, a Bachelor of Education in Physical Education. So that's where I landed, and for me, education for me is the key, and found that being in that job, I absolutely loved it.
Now, Lil, thinking back to the start of the pandemic, we were all very conscious about how much of a risk COVID-19 posed to remote and regional Aboriginal communities. Aboriginal Affairs New South Wales had a key role in keeping this disease out of those communities. What do you put that success down to?
Yeah, sure. Look, when I first came into the role, early in the role, and it wasn't long after that COVID came into play, and so once it started to happen, my thought processes was who do we need? Who do we need to make sure that this does not get into our communities, because it has the opportunity to devastate so many communities like it has right across the world, really, in that regard. And for Aboriginal people, there is a certain level of vulnerability. I mean, I don't like to term vulnerability too much, because sometimes when people see that people are vulnerable, they want to come in and help, but sometimes that's not necessarily the approach that needs to happen. So for us, it was understanding who we needed, and that was absolutely Aboriginal voices. So we needed Aboriginal community and Aboriginal community leaders, and then we also needed our government partners to understand what the voices were saying, what was actually needed for our communities, and being able to partner in a way that helped our communities protect themselves, really, from this pandemic. And that included things like community action plans. So the community set what was needed to happen, and then government listened and then partnered in ways that they needed to. So simple things like food security. I mean, we think in New South Wales particularly that's not an issue, but certainly for some of our remote communities it was, but also even more so, even in some of our metro areas, the access to food was not an easy thing to have happen at that time. So partnerships grew out of that, providing food boxes right across the state. In terms of things like signage, you know, if you're going to travel through, please travel through, don't stay too long. And it wasn't because they didn't want to see people, it was really about those being unsure of what they were bringing into communities. So it took a lot. It took also involving those who were already in a system. So if we talk about local emergency management committees that were already in place, how do we actually connect to the systems that are already in place? How do we grow people's understanding of what Aboriginal communities are feeling, and how they really needed to be their own voice in what was required? So that's ultimately what we did. We created the space for people to come together, to hear each other, but hear what possible solutions were out there, and that's where the partnerships formed. And those strong partnerships are in place still today. Those groups still meet, they come together regularly, and particularly in the recovery phase now, it's important that Aboriginal voices and interests are represented in that, and people can really hear what's needed to happen.
So tell me about the role that elders played, particularly female elders in community, how they managed to get that message across and to keep those communities cohesive at a very difficult time for all of us.
Yes, absolutely. Look, our elders play a pivotal role in our communities. They are really the strong voice. And when I say the strong voice, sometimes there's that voice of just resilience. You know, a lot of our elders, particularly our women, they're carers. They have grandchildren. They have a lot of kids or a lot of people living in their homes, and they are very special people for us. So our elders and their voices are the ones that we stop, and we make sure that we listen, and we make sure that we hear the messages that are coming through and act based on that. So our elders played a pivotal role in terms of COVID, but more generally in terms of keeping our communities together. They are the people that, you know, the phone calls that needed to happen. So we make sure that our elders are always in contact, and we are able to hear their voices and make sure they're safe in the first instance, because they're the ones with the knowledge, they're the ones with the history, they're the ones that you want to hear from a lot in things like COVID.
Lil, this pandemic has really turned people's lives upside down all over the world, especially for women and girls, economically and socially. Is this just a temporary speed bump, or are there some serious problems ahead if we don't actively ensure that equality remains part of the framework as we rebuild?
Oh, look, I think that's a given. It can't just be a speed bump. There would definitely be long-reaching effects if we don't now consider this in this recovery phase very much for women and girls in the space. So, you know, I think, you know, when we talk about the rights for women, and it's mentioned a lot about the full and effective participation. It's about that empowerment. It's about the right to be there, to be as equal as anybody else in that space. And it's about the right to opportunity. But I think it's more than that. You know, when we we've provided these opportunities, it's about making sure that those opportunities turn into real outcomes and that we don't let up on that. And through COVID, we may have seen some things might have gone a little bit backwards in the space, particularly when we talk about women and girls and economic outcomes. You know, from a social perspective as well, when we talk about maybe domestic violence in the scheme of things, but also, you know, the need for our young people to be able to have those opportunities into the future, and for young women particularly to have those to set up their lives independently for what they need into the future without having to rely on other sources in that space. So Look, in considering opportunities for girls and women, particularly from an Aboriginal perspective, we have a fairly high youth population from an Aboriginal and Torres Strait Islander perspective. So again, for me, it's ensuring that our young people have those opportunities, particularly our young women, and how do we make sure that we follow that through and that their voices continue to be heard in this process. We have a lot of young leaders, you know, growing up you have a lot of responsibility early on, and particularly our young girls and our women. So for me, it's important that we have a focus on that as well, from an Aboriginal and Torres Strait Islander perspective, for our young women and our girls, and even obviously our elders who, you know, will surround them in every way that they need to nurture through this space.
A lot of people have experienced a lot of pain, discomfort, inconvenience during the course of this pandemic in various ways. But there have been positives as well, haven't there? What do you see as some of the better outcomes of this pandemic, the sort of circumstances we've been forced into?
Yeah, I think early on it forced people of difference to come together fairly quickly, and to see each other as really people. It's that human nature aspect of it came through really quickly. I think another big part of that is understanding our connection to culture and to connection to country. So I think that's been one of the positive elements from a broader perspective of community, understanding how for Aboriginal and Torres Strait Islander people that connection to country is so deep. So when I sometimes do an acknowledgement, I say to people, I want you to have a think about a place. It's a place that you've been going for either, you know, it could be the last 10 years with your family. Have a think about that place. And I ask people to take time to think about, what do you hear? What do you see? You know, what can you smell? What can you taste? But ultimately, what can you remember? Who can you remember? What are the connections that you remember in that place? And so people tend to, as a result even of COVID, have understood there's a bit of a loss of that. So I think in many ways that's helped us understand the connection to country is so great. And clearly people want to get back out there as quick as possible to connect to country. And I think that's been part of the pain, not being able to see each other, not being able to connect with each other, but finding different ways to which we are able to do that. And now connections to each other are even more important because we understand the value of the loss of that connection to each other so much more greatly in the space. So I think that's been really the positive outcome. Partly too is the focus around economic recovery. We're really very focused on that now, whereas in the past we're still focused on it, but this is really key to people having full and productive lives that they're happy with, that they're happy to be and who they are as part of that.
When we talk about this idea of connection and understanding, it's really the first step, isn't it, when we talk about workplace inclusion? Why is that so important, and how do we get there if you might have trouble kind of reaching someone else and being open to that connection?
Yeah, look, for me, it's about listening and taking the time to listen. I love connecting with people, which is so funny because I like I said, I was just so super shy as a kid, and would stand in the corner and you know, I was the one over in the corner at the party or whatever that is. But the connection with people and understanding that what happens in this space between people is the critical element, and we come to it all with their own skills, all with their own experiences. And, you know, our uniqueness in that means that we build a uniqueness together in that space, and the ability to just step back and listen to people and really value who other people are as human beings and what they bring to the space is, for me, clearly the way to go. I absolutely love building relationships. I think that's the way we get things done. That's the way that we appreciate each other. And long-term relationships are so valuable in the space. And particularly when we talk about government working with Aboriginal communities is the key factor for us changing some of the things that are happening for our communities in that space. But you've got to value those relationships. You know, we're greater than the sum of all of our parts, as I would put it, and be open to that, because sometimes just deep listening will bring a different element to it. If you come with the purpose of hearing somebody rather than taking from something, then that's going to give you a positive outcome, I think.
Lil, it's good to talk to you. Thank you.
Thank you.
Nas Campanella started her career at the ABC as a cadet journalist in Sydney in 2011 before working as a regional reporter in Bega on the New South Wales far south coast. She's well known to Australians as a newsreader, reporter and senior producer for Triple J and other ABC platforms. Nas has also undertaken projects with ABC International Development, running initiatives for people living with disability across the Pacific. As current Disability Affairs reporter for ABC News, Nas has been reporting on the Royal Commission into violence, abuse, neglect and exploitation of people with disability. Nas, it's lovely to be with you. Thanks for being here.
Thank you for having me.
Now, you have been working as a journalist for nearly a decade now. Tell me what your path into broadcast journalism was like.
So I always wanted to do something in radio growing up. I think because I have no vision, it was just what I gravitated towards as a kid, and it was how I learned about the world around me, just by listening to music and people talking, and I loved everything about radio, the way people sounded and the way that it kind of evoked emotions and memories and things like that. So I ended up doing community radio at a very young age, and then a university degree, and did lots and lots of community radio right up until really getting my job at the ABC.
You've spoken about news reporting of people with disability as being sensationalist, either a pity party or inspiration porn. Tell me more about what you mean by that and how you've tried to change that discourse.
I think for so long, disability stories and issues and people with disability have been written about rather than kind of taking control of their own stories, and really it's being written about by non-disabled people, and that therefore means that the understanding of the issues that affect our community and the people in that really hasn't necessarily been as good as it could otherwise. And when you have lived experience and you're the one taking control of the stories and the portrayal of you and your community and your story, that's the best way to, I guess, have stories that are more positive, that really go to the heart of an issue that you're exploring. And there's a level of empathy, knowledge and understanding that people with lived experience have that non-disabled people simply don't.
And do you find audiences have been receptive to that?
I have found, firstly, from disabled people, they have felt seen and heard in a way that's never been done before, which is the whole reason why I wanted to do the Disability Affairs round. But then more broadly, from the general population, hearing things like, we didn't know this was an issue. We didn't know that, you know, we just didn't understand the kind of issues that impact people with disability. For example, in COVID-19, you know, we heard a lot about people feeling isolated. Well, people with disability have been isolated for a long time because of the structural sort of barriers and environmental barriers that we have faced for many years. Isolation was nothing new just because of the pandemic for my community.
Nas, when the pandemic hit last year, what was it like for people with disability trying to get access to information, services and help?
Look, initially the disability community really struggled to know what they needed to do, whether they could have support workers still coming into their homes. People went without support workers, medication. It was really hard for them to get out and about for different reasons. Me personally, I really had to change the way that I got to and from work. It was either I needed to be driven by someone or I got a taxi, because being on public transport, needing to sort of touch things to get around, I didn't want to do that. And I didn't want to be out and about going to different interviews and stories on my own, because if I got lost, I would need to sort of ask someone for assistance, and I didn't want to make that physical contact with other people. One really positive thing was telehealth. Now, telehealth is something that the disability community has been wanting for decades. And for the first time, you know, I spoke to a woman who hadn't left her home in 20 years because of chronic illness. And she was so delighted in the fact that she could finally have appointments in her room, without that intense kind of preparation that it often takes people with disability to figure out, how am I going to get to the doctor? How am I going to get into the building? Is it going to be accessible? And finally, telehealth meant that people didn't have to worry about all of that. They just needed to hop online.
Now that there's this momentum here, what do you see the greatest challenges and priorities are in maintaining that to capture everyone with those various needs?
I think employment has continued to be and will continue to be one of those really challenging areas. I think COVID-19's opened up some new doors for people. I'd say it's opened up doors for employers to see the possibilities rather than people with disability, because we've always been a very adaptable, resilient community. We are often having to come up with workarounds or solutions to problems that other people put in our way. And so it's really the employers that can finally see that working from home is a viable option, that flexible arrangements are not a bad thing. And really, I just hope we keep having the same conversations that we've all been having as an Australian community during COVID, that isolation for some people is a real thing, that barriers to employment and to education, that they're not easy to overcome when you're doing it alone. But when you've got a collective group of people, teachers, principals, parents, everyone working together, that it can be achieved.
I wonder how people see your place in a newsroom as a journalist, and whether they consider your abilities through a disability lens.
Yeah, I've experienced kind of the whole gamut of things. You know, discrimination was something I experienced from the minute I started looking for work. And it was anything and everything from people actually saying to my face in an interview, how the hell can you be a journalist when you can't see? Right through to people telling me, you'll never do television. Just the whole thing, you know, it's too expensive to employ people with disability, the lot. And I think for me, what was really great, particularly about the ABC, was the question when I was employed was, what do you need to succeed at this job? Because we expect of you what we expect of everybody else. And so it was an opportunity for us to sit down to discuss the types of technology I needed, to really kind of figure out, how was I going to do this in the same way that everyone else did? And I think that was what I needed. The reality is, overwhelmingly, research shows that people with disability stay at workplaces longer, they take less sick days, we're incredibly loyal employees, and we're, as I've already said, adaptable and resilient. The burden shouldn't be on us to come up with solutions to problems, but we're so used to it that we do it so well, and so we're always coming up with workarounds for whatever it might be.
Some people are not comfortable sharing their disability information. What can employers do to make that process easier, to improve that person's employment experience?
Look, I think a really good start is to obviously have all the proper policies in place, but those could sit in a drawer forever and a day. You know, you could have action plans and statements and all those grandiose things, but if you don't employ people, if you don't have people of all walks of life in your workplace, then people cannot see themselves in the workplace, and therefore they simply won't even apply. So for example, the ABC having someone that has eyes that don't look like everyone else's in a prominent reporting role says to the young person who's 13, 14, who's also blind or got a disability, sitting at home, thinking of going into journalism, actually, this is a really good place to start. This is something that you can aspire to, and you get motivated to work really hard, and then, you know, you can't be what you can't see. It's as simple as that.
And so for those young people with disability who look to you, Nas Campanella, as this beacon of what's possible, what would you say to them?
I'd say that we're in a moment in time, I think, where diversity is on the map more than ever before, and people are talking about it more than ever before. We're looking at ways to really create change in this space. And when I pitched the idea of the Disability Affairs Round, it was because I felt like disability had just been forgotten. It was the forgotten stream of diversity, and I think it would be foolish for people with disability not to seize this moment and just go, this is what I want. I'm going to reach out and work really hard, push for opportunities, ask for the support that I need to make this work.
Nas, how much does disability compound the experiences of women in the workplace already facing discrimination, inequality?
I think it's a really good question. I think women with disability in the workplace almost face a double disadvantage because they are women, and over time or historically women haven't put themselves forward for roles for whatever reason, perhaps that don't have the confidence or belief in themselves and their abilities. Partly it's because over time workplaces haven't had women with disability in leadership roles or women with disability employed at all. But I also think it's a notion of people not feeling like they have the confidence or the skills, or that they're going to have the support if they, I guess, talk about their disability. And it's compounded for people who have invisible disability, where it's sort of harder for people to maybe explain or ask for support or modifications or the reasonable adjustments they need to do their job. But I think the way to really combat this is to have employers provide opportunities for women with disability to talk about their circumstances, the support they need, to make it very obvious that things like flexible arrangements in the workplace are on offer, to ensure that if anyone does have a condition, whether it be invisible or very visible, to know that if they discuss that, if they talk about that when they feel ready and necessary, that they are going to be supported.
Nas, it's good to talk to you. Thank you.
Thank you for having me.
Now, we hope you're enjoying the event so far. In a moment, we're going to put some of your live written audience questions to our speakers, and let us know if you'd like those questions addressed to any one of them in particular. You can submit these using the Q&A window, that question mark icon on your browser. And unfortunately, Dr. Kerry Chant couldn't be with us this morning because of a prior engagement. However, I'm delighted to welcome back Lil Gordon and Nas Campanella.
Hello.
You've both been involved in some landmark national discussions. Nas, for you, it's been in leading the ABC's coverage of the Disability Royal Commission. Lil, for you, it was the new national agreement on closing the gap that was launched in the middle of last year. Nas, to you first, will this Royal Commission lead to significant change?
Look, I think it's really too early to talk about any sort of potential outcomes for the Disability Royal Commission. We've got a really long way to go. At the moment, the chair has asked the government for an extension until September 2023, and we are yet to hear as to whether that extension will be granted. But I think more than anything, one of the biggest things so far, and probably, you know, the biggest thing, even though we will have some recommendations at the end of this, is that we are hearing directly from people with lived experience. They are sharing their stories, often for the very first time, in a way that has never been done before. And I think being able to be sort of at the helm of our reporting in that and amplifying those stories, giving them prominent platforms and supporting those people to share those stories, I think it's a real privilege for me. And I think that's one of the biggest things to come out of the Royal Commission so far. And I really do hold this job so dear, because I think that it's such an honour to be able to do that.
Lil, the Closing the Gap agreement was the result of some unprecedented collaboration with government. How did you ensure that Aboriginal and Torres Strait Islander voices, women's voices, remained at the centre of that negotiation?
Sure, thank you. Look, I would like to start though by acknowledging country and paying my respects to elders past and present of those right across New South Wales today, but more broadly across the country for us. Look, I mean, for me, I didn't really have to do anything, you know. Aboriginal people came with their strong, loud voices at the ready. You know, when we look at, you know, leading off on that in terms of Auntie Pat Turner, such a strong advocate, strong voice, so resilient in that, and surrounded by the coalition of peak members as part of that strong partnership. The idea around the national agreement has 4 really key priorities, which are really based around partnerships and shared decision making. It's based around being able to build upon the Aboriginal community control sector out there who know best how to come up with those solutions for their own communities. It's about transforming, you know, more broadly government organisations, which include things like cultural safety, racism, but the accountability and absolutely shared access to data. You know, and information is important for Aboriginal people to know what they do. But look, for me, the strong women particularly that are in those coalition of peak organisations and also from a perspective of local decision making, OCA for us in New South Wales, opportunity, choice, healing, responsibility and empowerment have been a key aspect to this. So shared decision making is there, but this particular agreement is so strongly focused on that genuine partnership at the very highest levels. So for me, I think it certainly is another step in the process, which will be really great.
We're seeing sexual abuse, assault, harassment and intimidation being discussed like never before. It's an issue that seems to run from parliaments all the way down to our schools. Lil, there's clearly a shortcoming in the way we address these issues from a social and legal perspective. What can individuals, men, women, parents, organisations actually do about it?
Look, this is clearly a tough topic. And look, for me, I absolutely, you know, want to pay respect and recognise those that in any way have been impacted through these things, and there have been many. Look, from my perspective, there's a number of things that we can do, and I certainly pay respect to Australian of the Year, Grace Tame, and that in itself has brought that to the fold. So I think, as Nas mentioned before, there's so much more conversation happening in this space. There's so much more coming to the fold around this. It is something that needs to stop. It's something that needs to change. And in order to do that, there are many people that can be involved in doing it. From an individual level, I think for women, it's important to become as economically independent as you possibly can be. That's one of the things that I stress for any particularly young Indigenous women I'm talking to, my niece, even those around me, supporting each other, role modelling young women, reaching out. In terms of others, you know, when I think in terms of men, sometimes it's, you know, get out of the way. Other times it's very much about making sure they challenge what's happening in the space. Don't stand there and watch something happen. Let's challenge it in every way that is possible in that. For me, as personally, I have a 13-year-old son. For me, I absolutely want to make sure that I embed in him the strength of women, the absolute empowerment for women, the need for him to be respectful in all sorts of ways, and make sure, even as a very young person and a young man, that he calls those things out, be as brave as he possibly can in that space. But look, there's so much more to be done. But I think as we continue to have the conversation, but we be brave as we possibly can to call out those things is one of the best things that we can do and support each other through that. It's a tough topic.
Nas, people with disability are particularly vulnerable in circumstances of sexual abuse. Is there a danger that this issue will gradually disappear from the public discourse?
Look, I really hope not. As you said, the women with disability, or people with disability, do experience sexual violence and assault, and in some cases from, you know, people that they are supposed to trust, carers, support workers. And I think what's really important is that we provide mechanisms so that this does not happen. We provide support when people do reach out, that we provide that in a way that is specific to their needs, be it communication needs or you know, supporting them to go and share their story with police or whoever it is that they want to go and share that story with. But I think also more broadly, organisations are finally seeing that what happens outside the workplace impacts a person's productivity and you know, the sort of behaviour that they have and the mindset that they have within the workplace. And so I think finally organisations are seeing that they need to do more in this space. And I think as Lil has mentioned, we need to talk to kids about this. Something absolutely needs to change, and we need to be talking from a very young age about respectful relationships and what it means to provide support, and make sure that we provide that support in a way that is safe and specific to people's needs.
We're seeing people who experience inequality becoming more and more vocal about how they seek change, and that feeds into things like the Black Lives Matter movement, the Aged Care and Disability Royal Commissions, this big rethink we're having at the moment around the value we place in public health, particularly those workers on the front line and the income disparities that exist in our entire society. Nas, it's a long wish list, but what do you see are the most promising opportunities in how we build back from this pandemic?
I think the first thing that comes to mind for me, in particular for the disability communities, is employment. It's been a long-standing issue for my community, an issue where people have been excluded from mainstream employment. They've been discriminated against. We've experienced all kinds of discrimination to do with the workplace. And I think what would be really disappointing is if all of these things that we've been talking about during COVID-19, working from home opportunities, flexible arrangements, providing support, talking to people about their unique circumstances and providing the technology or the support that people need, and providing opportunities for people to manage both family, work and life. I think that would be really disappointing if we didn't continue that, because we all know that when we have not just any job, but a good job, we therefore have economic independence and we can provide for ourselves and our families. And so I think I would love to see this conversation around employment really continue, but also second to that, health and knowing that telehealth can be available for people who need it.
Nas, Lil, I want to ask you, with major changes like this in society, it takes a lot of momentum. How do you keep up momentum when sometimes the tide of stuff coming the other way just seems so great?
Look, you're right in terms of the tide of things that are coming the other way seems so great. When your life is a constant fight for change, it can be difficult, it can be draining, but luckily what drains me drives me. So it's about, for us as Aboriginal people, keeping going is really important in that space, but bringing other people along with us is the other part of that. We can't do this on our own. It's quite clear that that can't happen in that space. When we talk, you mentioned Black Lives Matter, that was difficult, and those conversations continue to be difficult, but it's an element of truth telling that's required before we can move on fully into this space. And there's a quote that the truth is quite often inconvenient. It may well be, but it needs to be talked about. Movement happens because it's shining a light on something that needs change. It doesn't happen because people have anything better to do in that. When we talk about some of the major impacts on Aboriginal people, they are high incarceration rates, they are poor health outcomes, they are things about improving education. There's so much in that is in some form the deficit language, but some of it has to occur. But there's also a lot of positive elements. But the key to that is working with Aboriginal people and Aboriginal communities. They're the voices. They best know what's happening for their communities on the ground. And it's really important that we continue to do that. It's that concept of, and it's a really great quote, and people get sick of me maybe saying it. It says, if you've come here to help me, you are wasting your time. But if you've come here because your liberation is bound with mine, then let's work together. If we truly believe that we want to be liberated as people in this country, then we do have to have a look at how we have that change. But respectful conversations followed by action is the thing to do. That element of deep listening is really important in terms of being able to keep the change going. But the willingness to sit and listen and really hear the hard truths, the trauma, the hurt, but the healing that can come with that is incredibly important.
I think the other thing I would add to that is part of the momentum is knowing that sometimes you aren't going to get it right all the time, but so long as you come from a perspective of wanting to listen, of wanting to learn, of being respectful and wanting to support, then I think that's a really good place to start.
All right, we're getting some really awesome audience questions here, and I want to roll in a couple that I'm seeing right now. This one's for you, Nas, from Siobhan, asking that as an able-bodied parent to a child with additional needs, how can she advocate for her when this child faces discrimination? And Bev had a question about how do you be brave? How do you exercise that bravery when you are facing that adversity, either for yourself or for someone else? Naz, I'll start with you.
It's not easy to be brave, and I've had moments where I have thought twice about speaking up about an issue or have had a lack of confidence about putting myself forward for an opportunity. I think it's natural to feel like that. I think we all do at some point in time, but I think it's being brave where you learn and where, you know, sometimes it won't always go the way you plan, but you definitely learn from those experiences. And I think so long as you are trying to put your best foot forward, I think that's what counts. But I think in terms of advocating, it's really important to be able to teach your children with disability to advocate for themselves if that's possible. And if they can't, then it is important that us as a community that we do that together. So you seek out the support that you need around you to be able to push for a certain opportunity or an issue, and also that find the people who will give you strength and who will provide you with the knowledge and information that you need to push for something.
Lil, this question about bravery is a really interesting one. I know you feel very strongly about education, Aboriginal kids in education. How do you teach them this idea of bravery?
Look, I think it comes long-standing, and it's every day that we do our actions. So the kids, you know, learn by seeing us be brave in that space, but they also learn by seeing other people be brave as well. And part of it is to having those conversations with our kids and more broadly our kids' friends, and being able to continue to have those, you know, like I said, really truth-telling conversations. But also, you don't necessarily want to scare kids ultimately to the point they don't want to engage with others or get along in that way. It's about really trying to make sure that they are safe in a space, they feel that they can do that, but they also feel they can come to you when anything is happening. I mean, for my son, you know, where I think for me, sometimes when you want to be brave every single day, but it's hard and it's tiring. I can tell you that when you're faced particularly with things like racism. But when it happens to your children, there's another level that you raise to. And I often try and find the spot that might make us connect on a way, whether we're parents, you know, whether we're aunties or uncles, what is it that helps me connect with somebody so that we can just get to some point where we can see each other's differences and have respect around that. So education is key, and our schools play an absolute mountainous responsibility in terms of being able to do that. So every day I would encourage teachers, I would encourage all educators, I would encourage all of those around us to continue to just, even if it means you stop and you think. For me, I take some deep breaths most days with the view that I'm going to step in something because it is going to change. I have to truly believe that there is good in people, have to truly believe that we can make a difference and that we can be who we need to be.
A question from Kate. Lil, I'll start this one with you. What is it like as a woman representing your respective communities, for both of you, to walk in two worlds? I mean, when you step out the front door in the morning, do you feel like you're wearing a few different hats, Lil?
Look, I feel like I'm wearing a cloak of hats on some days, given that, you know, I'm also gay. So, you know, a whole lot of diversity wrapped up in this package for sure. So for me, you know, when I talk about walking in two worlds, I feel an absolute responsibility to make sure I do that and do the best that I possibly can in that, because there are people who don't necessarily know what's happening, or not that they don't know what's happening, they may not know how to help, or they may not know what to do. So it's really important that I have as many connections as I can, that I remain authentically me. I mean, I don't know any other way that I can remain authentically me. You know, I've got dreadlocks and I turn up as me every day, and that's what I feel that I have to do. But I also want to connect with people, you know, just smiling and being open helps people feel a bit relaxed and be able to approach you, so you can continue to have even the hardest conversations. You may not agree at the end of the day, but at least you've heard from each other. We've learnt from each other. The thing that happens between two people or a group of people, that's where the magic happens. And then you learn, you grow, you heal from that, and you take that to the next conversation. And for me, that's where it happens, and it continues to grow from that point. It's not easy. I'll tell you, it's not easy walking in a number of worlds, but that's who I am, and I feel like I have to help people come along on that.
Naz, a quick final thought from you on that?
Yeah, look, I completely concur with Lil. I personally find the burden of being an advocate in this space quite exhausting. And like Lil, I will never say no to someone. Obviously, my job is not to do individual advocacy. But when you have someone stop you in the middle of your grocery shop and say, I'm really struggling to get my daughter who is deaf any equal access to education like my other children, or when you get an email from an advocate saying that someone they're supporting has been denied access to certain services, you can't help but want to support them and to give them advice or point them in the right direction for services or contacts. And I see it as, there are so many brilliant advocates working in the disability community, but there's only one of me in media and who is able to really put these stories on a national platform in the form of a disability affairs round. And so it is really difficult to wear all these multiple hats, but it is such a privilege and a huge responsibility, and one that I take extremely seriously. And there will never be an email that goes unresponded or a phone call that doesn't get returned from me, because it's just who I am. And I had so many brilliant people who supported me to get to this point that I see it as a duty really to give back. And because I want so much for our community to be strengthened as a whole, and so I see my small part that I can play as small as it is, as an important one.
And I think, Jeremy, if I could just add to that,
Naz, it's really just like terrific. Yeah, please go ahead.
Sorry, if you can imagine us stepping into a space wearing so many hats and carrying a lot of that responsibility, if somebody can recognise that when you're stepping into that space, that I'm coming with a load. If you can recognise that from the start, it makes that easier for us too as well, because it's about how much we're carrying and the responsibility, which I happily take on every day, because, we stand on the shoulders of giants, and I particularly talk about our elders in that space. So, it's just something for people to have a think about when we step into that, what we're coming into it with.
Lil, Naz, really so great to have both of you on this panel discussion. Really appreciate your time and your insights. And to all our viewers as well, thank you so much for joining us. I hope you've found it enjoyable and it's given you some food for thought. Now, your opinions are also important in helping shape the future of workplace inclusion right across New South Wales Government. So please take a moment to complete the survey at the end of this broadcast and tell us what you think, what we can do next time that you'd like to know more. But for everyone who's watching, happy International Women's Day. May you be strong. May you live well. Take care. Bye-bye.
Thanks, Naz, too. Thanks, Jeremy.
Thank you, Lil.